Hello everyone, Mrs. Yapalo here with an introductory video on microbiology lab sessions, what the scope of microbiology lab sessions is all about, and also on our actual lab session for today, which is parasite identification. Please bear with the amateur videography, but this is the most effective way to use the time we have the best we can. So please make sure you give this a listen, because we're only doing a lot of just viewing under the microscope. Okay, so introductory notes. Here we go. So the overall objectives of the microbiology lab sessions are to appreciate the diagnostic tools commonly available or commonly used, to also appreciate that the diagnostic cycle begins with the established clinical suspicion, which comes after medical history and examination, which then dictates the specimen that will be collected and the laboratory investigation that will follow. And then lastly, to appreciate overall the process of identifying the infective agent. So recall the components of the course: the parasitology, the bacteriology, and virology. So whether it is a viral infection, a bacterial infection, or parasitic infection, the goal in the microbiology department is to establish what the infecting agent is. Okay, so that is why now we are talking about the diagnostic tools. What are the diagnostic tools available? What are the laboratory methods available? So as you can see in the screen there, we have the non-cultural methods, which include the microscopy and the molecular tools. We can also have the cultural methods themselves, which is, liquid media, solid media, or the cell cultures for the viruses. And then finally, the immunological methods, which are detecting the pathogen antigen or the host antibodies. Okay, so non-cultural methods, we can throw in the actual immunological methods under natural non-cultural methods, but it's just a nicer distinction to say immunological methods on their own, but they're obviously non-cultural methods, right? Okay, so that being said, when we talk about bacterial infections, all the tools, all the methods just in the preceding slide that we've mentioned, they are applicable. We can use all of them. Under the viral infections, we can also apply all those methods, but we should state that the culture method is very, very complex when we're dealing with viruses and very time consuming, which then takes away from turnaround time in clinical diagnosis when results are needed. And so basically, we're saying viral infections will rely more on the non-cultural methods and the immunological methods. Okay, and then for the parasitic infections, which is really our focus today, parasites. So for them, they will largely be using, or use rather, non-cultural methods and the immunological methods. Okay, it's very, very rare to use culture for a parasitic infection. Okay, one or two here and there, but you can never really say that cultures are used for a cultures are used as a diagnostic tool for parasitic infections. That's how rare that option is. Okay. So even our discussion is on what is available, what is commonly used. And so that is now our parasite identification. And we have the objectives listed there, which tie into the commonly used methods that I've just mentioned. Okay. So basically, we have the microscopy that we want to use to determine microscopic diagnostic stages, okay, in the specimens. For example, the specimens we have a protozoan in the lab session, we have a helminthes, okay. So the microscopy we will use to appreciate the morphological stages that are detected in these specimens, and then also an emphasis on the clinical specimens that are used for these kinds of investigations, where we're looking for particular morphological stages of the parasite of interest. And finally, the fourth objective there, to appreciate the basic scope of immunological methods using rapid diagnostic tests as an example. Okay. That's just rehashing what I just said. I think maybe a note there, molecular tools, of course, under non-cultural methods, they're very much a viable option, but these are usually found in specialized laboratories, advanced laboratories. So it's not something you expect as a routine option. Okay, it's very dependent on the setting. Okay, that the level of the availability of tools in the setting you find yourself in. But again, we will talk about the commonly used that you will find wherever you go. Okay, the commonly used tools. So in our leaflet there, we have part A, our microscopy. Okay, and then part B, a brief introduction in the leaflet about immunologic tests. Okay, which is what we will. This is how we will break down our tasks as well, because basically, what you are doing in the session today is going to the microscopy stations.